There's a common notion when it comes to understanding muscles in the human body that muscles are either long and weak or short and strong. So an example of a long and weak muscle would be people who have very flexible yogis who can get into end range positions, but they don't have a ton of strength around those positions. The opposite is your short and strong muscle bound bodybuilder. But in this video, we're going to talk about the kind of exception to those things where muscles can be both short and weak at the same time. So in this video, you'll learn more about tight and weak muscles. The first reason that muscles can be both tight and weak is a principle called adaptive shortening. And adaptive shortening occurs when a muscle is put in a shortened position for a long period of time. So this can be due to repetitive postures or prolonged repetitive activities. Now, the muscle doesn't get stronger because it's in that shortened position, but the muscle fibers over time actually adapt to the shortened position. A very common example of this in the human body is the iliopsoas muscle. So the iliopsoas, or the psoas muscle, runs from the transverse process of T12 to L5 and then inserts down onto the femur. So it primarily acts as a hip flexor, some hip external rotation, and then it helps bend the lumbar spine. But if you sit for long periods of time, that muscle can become adaptively shortened, and then that changes the ability for the lumbar spine to extend. It changes for the ability for the hip to extend, and then it also leads to weakness in hip flexion. The second reason for tight and weak muscles are muscle imbalances. And that would be an example where one muscle is put in a chronically tightened position, and because of that, the opposing muscles can't direct the muscle into an optimal length tension relationship. An example of a muscle imbalance in the body would be the upper traps. The upper traps often get pulled into this tight, sort of chronically active state, but they're active in a position that's not their position of function. So with the upper traps, if the shoulders draw forward for a long time, that puts more tension into the upper traps. So these muscles are working, but they're not working in their position of function. The upper traps need to work to elevate and help upwardly rotate, so shrug the shoulders up. But if you don't have the optimal length tension, the low traps, mid traps, and serratus can't pull the shoulders back. So muscle imbalances are a very common reason why muscles can be both short and weak at the same time. The third reason muscles can be both weak and tight is neuromuscular inhibition. And this happens when the nervous system, as a protective mechanism, actually stops the ability for you to activate a muscle. What this looks like in the body is, let's say someone has a knee injury and the quad starts resisting the ability to flex and straighten out. So knee flexion is going to stretch out the quad muscle, and that might feel tight in that muscle. But at the same time, because of the neuromuscular inhibition, the protective mechanism of the quad limits your ability to fully activate and strengthen through the quad muscle. And that's why after rehab or after a knee injury, initial stages of rehab are all about quad activation, regaining that neuromuscular inhibition that has set in because of swelling, because of pain, and we need to reset that neuromuscular inhibition that's present. The fourth reason for tight and weak muscles is poor motor control. And what that means is that the nervous system cannot recruit enough neuromuscular control to help support the length of a muscle. I think about this as a common example is individuals who have very high arches and rest in a lot of supination of the foot. The posterior tibialis muscle needs to be able to eccentrically lengthen to stretch out the arch to get the spring of the arch to push off. And if you are stuck in a high arched, inverted supinated position of the foot, then you won't let the arch collapse because you don't have the motor control and the coordination of the posterior tibialis muscle. So the next common cause is a lack of motor control of the muscle is a common reason where a muscle can be tight and short, but also lack the functional strength to perform. And lastly, the fifth most common reason that muscles are both tight and weak is protective tension. And that would be a muscle is held in a shortened, tightened position to try to help stabilize a joint or to compensate for muscle weakness elsewhere. A common muscle in the body that exhibits this is the biceps muscle. So oftentimes the bicep muscle will get pulled because of its attachment up onto the scapula, will get pulled into the glenoid here, into a flexed position like this. But when you test the strength of it, where the shoulders need to be back and you're holding this position, if the bicep is trying to protect the position of the shoulder, it doesn't want to be here, you'll see a compensatory forward anterior tilt of the scapula as a way to compensate to help protect the shoulder. So the bicep is a great example of protective tensioning, a short and tight muscle that can't hold true functional strength and position of the arm. So in summary, there is numerous reasons why muscles can be both short and tight. Those could be everything from neuromuscular inhibition, protective mechanisms, muscle imbalances, a lack of motor control, adaptive shortening of the muscle. And the key when you're looking at this in the clinic, or if you want to test this on yourself, is that one, you need to test muscles in their functional position. So make sure we're not losing body position and alignment when we're testing and assessing these muscles. Two, we need to check muscles through their full range of motion. So checking the ability for a muscle to hold an isometric position, to hold a joint position as the muscle is getting into a shorter contracted position. And then in the example of the psoas, making sure that the muscle can hold hip flexion in a contracted position, but also then lengthen and work in an eccentric position as well. So looking at the muscle through the full range of motion and testing the strength both in shortened and lengthened positions will give you a good indication of which muscles are both tight and weak at the same time.